Hello, everyone. Welcome back to As We Speak. And today I have Dr. Rania back here with me, and we're going to discuss something that's on all parents' minds: teenagers and vaccines. Should we be giving our 16-year-old vaccines? So, Doctor, welcome back. How are you?
I'm fine. How are you? Thanks for having me back.
Good. So, Doctor, what do you think about this? Do you think 16-year-olds should be taking the vaccine at this stage, or can they handle sort of getting a COVID infection and getting it sort of done with?
Yeah, I mean, medically speaking, there isn't a real difference between a 16-year-old and an 18-year-old or a 20-year-old. So in terms of their sort of ability to withstand the vaccination, I don't think there's any difference there. Should they battle the infection rather than the vaccine? To be honest, that's the statement that worries me the most. The thing about COVID, there's been a lot in the news lately, is the worry is the long-term complications that are difficult to predict even from an early infection. And whereby we worry more about people in our generation or the older generation, I would say that, if for someone like me, I'm 42, if I was, because of COVID, to get some early, I don't know, hypertension in my 50s, it's probably acceptable. Whereas, do I want my 11-year-old, 12-year-old, or 15-year-old to have some microvessel damage because of COVID and end up with early hypertension in their 30s? So actually, I would argue that the younger someone is when they catch COVID, the more you want to worry about these long-term complications, the less likely they are to happen, by which we can predict who is going to get long-term complications. So the challenge with COVID is we don't have a diagnostic test or a test in the beginning to try and predict who is more likely to need hospitalization, who's more likely to get complications. So you can't compartmentalize easily people who get COVID, and be able to say, oh, you 16-year-olds should have this vaccination, but this group of 16-year-olds doesn't need them. You see what I mean? Right. So I think once these vaccines are trialed and tested on that age group, they will become safe to give. Don't forget, the 16-year-olds around the world are doing examinations in order to do their university applications. So yeah, these are people who probably do need a lot at some stage during their academic year to be on campus wherever their school is. So surely they are the ones who need to be protected the most in order to complete that, because this is one of the biggest impacts. I know it's true that this impact is the same around the world, but if we can minimize it, why not? I mean, I know the big, upheaval that the decision to not do O-levels and A-levels this year, the effect that has had. So I think looking at that age group is important. But it would be nice to have more options. At the moment, it's only the Sinopharm here that's, as far as I know, licensed for use for 16-year-olds. It would be nice to have more options and to have more data. As a parent, I always tell this to my patients, when you as a parent decide to give a vaccination to your child, you don't want to feel bullied into it, you don't want to feel pressured into it, you want to feel that you've made a very informed decision. So I think when it comes to deciding to vaccinate someone else that is a dependent, more data would be welcome.
For those parents who are seriously considering vaccinating their 16-year-olds for whatever reason, do you think they need to take any precautions, get any blood tests done, check anything before they embark on such a new vaccine?
No, I mean, considering the nature of the vaccine itself, there are no pre-vaccine checks that need to happen. I think if your child is at an age, and especially during like the post-lockdown period where people didn't need to see a doctor or have been avoiding doctors, it's a good opportunity to do a wellness check with your pediatrician prior, just to make sure that you've crossed the T's and dotted the I's. But there isn't anything specific pre-vaccination necessary.
Doctor, would you give your child the vaccine?
Would I give my child the vaccine? Well, luckily, well, my children haven't reached that age group yet. But once the vaccines are licensed for my children's age, then yes, I would give the vaccine, because I have more fear from long-term COVID than any vaccine. And I think this is the bit that people really need to focus on. just because it's not been spoken about, it's because it hasn't happened yet. But we do know in adults with early on in the pandemic are beginning to show signs, worrying signs of unpredictable sort of organ involvement, like brain fog and kidney renal damage and other types of damage. It would be, for me, I really do hope that pediatric COVID doesn't do the same in children's bodies, but scientifically, why wouldn't it? They are protected against severe infections anyway, so the likelihood of anyone getting complications is so much smaller than in adults. This is a guarantee, so I'm not trying to scare people, but what I'm trying to say is if we don't know what the likelihood is long term, and it's more predictable to guess the long term likely effects of a vaccine, which are honestly nothing to worry about, then I would rather hedge my bets on the vaccine and not.
Okay, now, doctor, again, given either late positives or false negatives, whatever you want to call them, it is very. When do you really recommend that that kids really need to get a PCR test? It's very traumatizing. I know to constantly keep testing. Oh, my child has a sniffle. Should I go get a test? I mean, should you wait for a sniffle? Should you wait for a fever and a sniffle? Right now, given the scenario right now, when should we be doing it?
Yeah. So right now, any symptom, ideally you would get a PCR right now, because as you said, every second person has COVID, and it is so prevalent, and it's prevalent in the younger age groups. Many of them could be asymptomatic, so it's very easy for your child to acquire COVID. So I think the right time to do PCR test, first break it down. If you know you've had a contact, doing it immediately doesn't make sense. Do it 5 or 6 days from the last time you had contact with that person.
Mm-hmm.
Do it sooner than that if any symptoms develop while you're waiting for that. During that time, quarantine because you have been in contact, and protect vulnerable people. Don't go visiting your grandparents or anything like that. And then if you have a fever or a cough and you want to go back to school when you're better, I do hope all my colleagues in Dubai and the UAE and the world are doing this. You cannot get a school certificate because you cannot be certain that you don't have COVID without a PCR test. So another issue now is that it is a back to school ticket. That your PCR test is negative and you are asymptomatic. It's not enough to have a negative PCR and a runny nose. You still have to have no symptoms. So I think at the moment, get a PCR test if in doubt at all. There is no way. I wish we had a list of 2 symptoms are okay, not 2, 3 symptoms, go get it. We don't have that. You could have headache and nothing else. You could have a backache and nothing else. You could have diarrhea, headache, backache, cough, and no fever. You could have just a fever. It's just so variable. And I have seen every single symptom in so many children, and it's so difficult to predict. I would say do take advantage of the easier testing methods. So saliva test, don't overlook that. It's now available in quite a few centers. I heard from a patient of mine today that she took her children to King's and they had such a good experience. It wasn't busy, it will become busy now, but their saliva test is really easy. Children spit into a tube. I mean, what child doesn't know how to collect saliva? It's not invasive, it's not painful, it's almost fun to collect your saliva and spit into a tube. So it's not a traumatizing, psychologically traumatizing experience. So many places will do throat swabs very acceptably, and they're just as accurate if done properly. And for the older ones, yes, nasal swabs are traumatic, but they're quick, they're not as bad. So I think don't overlook the need for a PCR test because of the trauma. There are now quite a few methods that you can do that aren't as traumatic, and just make use of them.
Okay, doctor, and to end this questionnaire, when do you think our kids can go maskless? Ballpark, how many months?
If I had a wish, I would say it would be very nice to start the new academic year in September maskless. I feel that with the recent surge in numbers, that's looking less and less likely. Look, it's so difficult to know. It's anyone's guess. I don't know. I think, what will go first? Will it be the masks first, but the distance remains? Will it be the distance goes and the mask? It's so difficult to know. Yeah. It's a very difficult answer. I would say that if it were to happen during this year, 2021, it would be a miracle, but it's not a miracle that's difficult to attain if enough of us get vaccinated. Right. That is the way out. There's no shortcut here. You can't sit at your house you can't party on and expect COVID to go. If we all did sit in our houses properly, which is also impossible, COVID may go, but if we don't actively do something about it, it's not going to go.
Right. On that note, thank you, everybody. Thank you, Dr. Rania. Let's remain.
Thank you, Karishma.
I hope you guys, I hope you enjoyed this. I hope it was informative. You can reach Dr. Rania on her Instagram at Dr. Rania DXB, and she practices at Circle Care Clinic. Thank you so much, Dr. Rania.
Thank you, Karishma. Thank you. Thank you, everyone. Have a lovely day. Take care.